Good afternoon. Good afternoon, Dr. Buffy and everyone else. It is another opportunity for us to open up our monthly meeting today for the Board of Health. And I will quickly pass the mic and the platform to Dr. Buffy.
Thank you. So I'd like to call the meeting of the Board of Health to order. First item on the agenda is approval of minutes from the board meeting of April, from our April meeting. Mr. Fisk, any changes or recommendations?
None here.
Okay, so can I hear a motion to approve?
Well, motion to approve the meetings of last week.
I second, so the minutes are approved. So next item on the agenda are special items to be heard by the board. So before us are Mr. May and Mr. Fay concerning adoption of NIH guidelines for recombinant DNA and turning Brockton into a bio-ready community. So I'll hand this over to Mr. May.
Well, thank you, Dr. Brophy and fellow board members, or other board members, excuse me. I'm joined this evening with John Fay, who is a senior planner here in the Department of Planning and Economic Development. And this is probably the third meeting that we've had with you, the Board of Health, to discuss adopting the National Institute of Health guidelines on rDNA research. Adopting such guidelines would help elevate Brockton in the firmament of communities in Massachusetts that are considered bio-ready. Those are communities like Brockton and Cambridge, but it also includes smaller towns throughout Massachusetts. So it's not, I wouldn't call it a big lift for the Board of Health, but it sets the standards for future investment here in our community around life sciences and particularly bio manufacturing and bio research and development. So we've sent you copies of both a resolution that the Board of Health could adopt. It also includes a copy of the National Institute of Health guidelines. We've included a draft application that the board could consider using, and especially Dr. Montesor and his staff, who would be accepting those applications and bringing them to the board. And I believe there was one other piece of information, which is the Mass Bio's Bio-Ready Community Guidelines, which is talks about what we as communities can do to advance and support the life science and biotech industry here in Massachusetts, which is the #1 bio market in the country. And we need to maintain our lead as communities like San Francisco and Raleigh-Durham and Middlesex, New Jersey are biting on our heels, trying to attract business out of the Boston metropolitan area. And so we are working with Mass Bio, which is a trade group, and the Mass Life Science Center, which is a state government agency, to advance our ability to host sites in Brockton. Amen.
And Mr. Fay, any comments from you as well?
I think Rob covered it pretty well.
I'm a talker.
Thank you.
Yeah, so I think we've from the board end, we've seen, at least I had seen the guidelines, the NIH guidelines prior to this, and had gone through it. And I think last meeting, Mr. Fisk had not, and Dr. Andre had not received the material. So at least Mr. Fisk has now had a chance to read over. We haven't got any input yet from Dr. Andre, who's unable to attend the meeting this evening. But, you know, as far from my end, as far as adopting the guidelines, I have no issues with the, following the guidelines as we discussed last time, and some of the information they've supplied, I appreciate, because it comes down to, not just allowing and accepting this, which would be wonderful for the city, and it will allow companies that are using this to come into the city and to be able to manufacture and produce scientific developments that come from recombinant DNA use. But we had asked, what are the requirements of the Board of Health, and sort of on our end. It sounds like, looking over some of the things, there would be things that people would come to the Board of Health to be reviewed about their capabilities. There would be inspections on our end, and also sort of setting up a reporting, how our what kind of reports would be coming back to the Board of Health, as far as assurance that the guidelines were being followed, and the industry that was there. So it appears that much of that information is there, which I appreciate. But it also brings up the issue of resourcing as a board to be able to do this work. So, a commitment from the city, because this is a different level of inspection that needs to be done in sort of the manufacturing of these products. So, so I think there are steps in the city that we will have to at least ensure that the board has appropriate staffing and further, outline the guidelines as proposals come to us. As to how to do this, and I really, some of the documents are there, but I'll sort of come back about discussions about resources, etc. That will need to be in place. Yes.
If I could address that just quite quickly, the resolution that we have in front of you, I believe, includes language that would allow the Board of Health to hire an outside consultant to help it do the inspections and to review the applications and provide technical resources and assistance to the Board of Health, and that it would allow the Board of Health to set a fee, an application fee that would cover the cost of hiring that outside firm. So the planning department, as an example, has hired what we call a house doctor consultant that reviews major developments that are coming to the city. Right now, that is Beta Group. And so when an application comes in, the Beta Group then reviews that information and formally reports to the planning board as to the quality and efficient and completeness of the application. Are there any questions or concerns that they have? And the applicant then has to respond to that. And the great part about that is that the applicant pays for that review. We choose the reviewer, but the applicant pays. And a lot of smaller towns are doing that right now.
Yeah, I read that in the
okay,
report,
good.
But it's also in the it's not just the application and the startup. It's the continued, running any laboratory. It's the continued assurance that guidelines are being met, and the inspections that are taking place there. So I had some
they can continue to do inspections for you.
Yeah,
and they will need to set up. Oops, sorry.
Go ahead. No,
they will need to set up
this. Yeah,
institutional biosafety committees as well. Each firm that does operate in this area needs to set up their own committees. There will be residents on their committees. I think by law, they have to have at least one resident, at least one subject matter expert, and then I believe some employees from there. So it is an iterative process that they are continually checking in, making sure that they're keeping up to the good manufacturing practices, et cetera.
Right, and requirements of that. Those are the things, but it's also the reporting of events and guidelines for the reporting of those events, because that's a routine and quality sort of procedures, and I'm not sure outside certification is always good for a laboratory, and it's always an arm's length away of the review committee from those. So I like that the consultants are there, that there's a planning group in place. But again, it eventually comes back to the board, right? So support for the board as well in, getting reports that the members on the board understand, but also the timing of those reports when events happen, that we are notified right away. The city would need to be notified of events and our response if an event occurs. So I think those are long-term down the line, an iterative process of doing this. But, any laboratory, there's reporting up. And it looks like in the guidelines, if there is a serious event, it has to be reported up from the company, but also communication to the city where it's being, where an event may occur that may have impact in the city. So how these committees interact with the board is kind of a little bit of how this consultant group works in conjunction are things that can be iteratively moved forward. I have no problem from my end, and I'll let Mr. speak as well, of saying yes, we should move forward with this. It is an iterative process of moving forward. When things come before us on the board, things need to be approved. But I think by the time those things happen, there should be an iterative process of creating what the board wants reported to it, when it wants reported to it, and then how some support for others in the board that may not be involved in basic bench research or understand some of the issues around it. We're looking at it from a public health standpoint, and they're looking at it from a science and a manufacturing standpoint. And sometimes us understanding each other's language, having sat on things like this, is important, that there's a pathway, that the communication is clear, that members of the board are able to understand, and the Board of Health is able to understand, and have a plan in place. And I don't know if the other community, if there is issues around, they say you should have plans in place and the guidelines, for when these things happen. But again, that is an iterative process. And as far as moving forward with moving forward to become a community, again, I have no problems with that, following the guidelines. I love that there's a consulting group, and the devil of the details of the consultation and how the interactions and how the communication pathway between us, all of us that will be involved in this, are taking place. The manufacturing part, the city part, the Board of Health's perspective, as well as state requirements as well, and federal. So Mr. Fisk, I sort of.
Well, I'd like to be able to study it a little bit. Yeah, I'd like to be able to study it a little bit more. And also, I think that, we should have a full board along with Dr. Andre before any decisions were made too. So, the three of us could discuss it a little bit more.
Yeah, and Mr. Fisk, do you feel like you need, because not having as much of a bench science sort of background, this is maybe where, discussion with the consultants to help, in preparing stuff for the board, that as reports come through, we can guide. The members of the board will be able to decipher and understand what's being presented to them. So I think we're on track. And as we talked about earlier, it is an iterative process. And I think if we have to call a special committee because there's conflicts, which there have been with Dr. Andre's schedule, I think we may, Dr. Monsour, set up a special committee meeting in order to have input from the entire board before making a final decision. So.
Sure.
Okay.
And if there are other resources that the board would like to have present, we certainly have contacts at several of the universities and at Mass Life Science and Mass Bio.
Yeah, and
it could become
available. What would be very helpful is sort of looking at it from the Board of Health perspective. So for the Board of Health that have passed this and have to go through it, what their requirements are, what their plans are, because if there are cities out there like this, as much as they could share, I don't know if the Mass Department of Public Health has this, but as much as they can share the guidance for, decisions made by the Board of Health, the reporting to the Board of Health, the action plans of the Board of Health, if those exist, we don't need to recreate the wheel. I would be happy to see what's out there, what's been functioning in the Board of Health that are there. So not just the manufacturing biotech sort of part of this, but the public health part of this in cities that are already doing this. would be very helpful, I think, to the Board of Health to be able to present.
Well, John, I know what you're doing tomorrow.
All right. You know, I think Dr. Andre, who of course is very involved in public health, yeah, will be that will be a perspective that he would I believe would be pushing for as well. So.
He has a very unique background and would be very valuable on this.
He would be very valuable on this. Yes. So all right.
All
right.
If I may come in, should I? Maybe we could talk offline after this, Dr. Brophy, and then I could follow up with you and see when Dr. Endred might be available, or how we can make a special arrangement. We can maybe discuss that offline.
I think, and yeah, we can discuss it. I don't think we can set it now. We need to speak with Dr. Andre, and we also, you know, the usual that if we are going to have a special meeting, it needs to be a public meeting, and the arrangements made and the announcements made for that. So I think the most important thing is finding out Dr. Andre's availability and matching it up with Dr. Fisk, Mr. Fisk and myself, as well as the board, and as well as the Mr. May and Mr. Fay, to be able to, you know, come together. And even if the materials that you get from other boards of health can be disseminated to us ahead of time, if you are able to get these materials, that would also be helpful, because we could look at it ahead of time and come into the board aware of those things, and hopefully move things forward more quickly. So it sounds like we have a plan. So the action items coming from here is for Mr. May and the group to try and gather as much information as they can on the cities that are currently doing it, from what their public health departments are doing in response to this, and then on our end from the board to set up a special meeting and as much as possible to get the materials out to us ahead of time, assure that everyone has reviewed those, and that we can come to this meeting sort of with hopefully a plan of all things settled and a path forward. So.
Sounds wonderful.
Great.
Let us know what dates are available, and we'll look forward to a communication from Dr. Montesor, and moving this forward. Bye.
Right.
Yes, absolutely. We will go ahead, Dr. Brophy.
No. I was just going to thank you for coming to the committee. I realize you've been here. This is your third appearance at the committee, and we are making progress.
We are. We appreciate it.
Yeah.
Okay, thank you.
Very much so.
All right, have a great
Okay,
weekend.
thank you.
You too.
Thank you for coming. Thank you.
Thank you. Okay.
All right.
So at this point, Dr. Montesor, should we, there's an item that you'd like to add to the agenda?
Yes. Let me give you the address here. It is a convenience store that is located at 662 Belmont Street and Brockton, Massachusetts 02301. And probably Mr. Attorney McCluskey, who is representing the business owner, may maybe give us a little bit more broader understanding or issue on the business.
So this is about a tobacco permit for a convenience store. Is that correct? So
Correct.
Okay. So yeah, so the board has not had any information on this. This is just being added to the agenda for this evening. First of all, can I just have a vote from Mr. Fisk to make a motion to add this to the agenda, which was not published prior to the meeting?
No, I have no problem with that.
Okay, so I second the motion, so all in favor is aye.
Aye.
And so we'll move forward with the discussion about what the request is, so that the board can understand the situation. So.
Are you ready for me to go?
We are ready for you to go.
Go right ahead.
Well, thank you, members of the board. I appreciate, my name is John McCluskey, Attorney John McCluskey, here at 1325 Belmont Street in Brockton. And I represent Vanessa Gumbert, who is the principal of Belmont South LLC, Belmont Street South LLC, which is the owner of this property. Belmont Street South LLC owns other properties in the immediate vicinity and is working to develop them. This property, now this is going to test your age. This property, going back many years, used to be a shoe store called the Lodge, and it's at the apex of the intersection of I believe it's West Street and Belmont Street, but with the address of 766 Belmont, and it's that triangular shaped property with a store on it that's been vacant for many, many years. After the Lodge, which is, I think that goes back to the late 60s, early 70s, where we'd go in and buy awful looking boots and things. And it was a place to go, but then it turned into a convenience store years later, probably had several different tenants over the years. But the last tenant was a 7-Eleven, and the 7-Eleven was there for many, many years. So it was a convenience store, and there was a cigarette tobacco license at that site. 7-Eleven, for whatever reason, decided to pull out, and it's a very difficult location because it's very limited in parking. So it's probably been vacant and an eyesore. You've gone by it 100 times in the city, and it sort of cries out for some activity. Vanessa and I recently met with the mayor and his staff to go over this property and another project. And the mayor was very interested in seeing something happen here. Vanessa has a pending lease with Mr. Patel, who he owns several other businesses in the Brockton area, lives in Brockton, and would like to put in this food mart. It's called the Go Food Mart, which would accommodate parking just right, people coming and going, accessing it as a convenience stop along the way on Belmont Street. But unfortunately or fortunately, what makes these businesses work is a tobacco license. Mr. Patel knows that he's not going to be selling any type of flavored tobacco products, and it would be the standard typical product that you'd find in a convenience store. We're asking the board for a waiver of the existing moratorium for several reasons. One, because first of all, this property's been vacant for so long. One of the members of at the meeting with the mayor was John O'Donnelly, assessor, and he was certain that, of course, this would bring more revenue to the city of Brockton. The mayor, Mr. Sullivan, felt that because it's been such an eyesore for so long, that we really need to have something come in here. Vanessa's been trying to rent this out for years and years and years. She recently, just as an incidental, we went to the zoning board of appeals, and there's a Kentucky Fried Chicken that's going to be built along the opposite side of, actually the same side of Belmont Street, near the high school. And she's got another site up there, and she's trying to revamp her strip mall towards the back. There was recently a liquor license that was just approved by the licensing commission. So with the mayor's support and encouragement, we were kindly asking the board to allow a waiver of this moratorium. I don't think it's going to, this is a type of store that you drive by and you stop and you buy milk and et cetera, and you buy a pack of cigarettes. And quite frankly, we all understand the problem with cigarette sales, but I don't think it's going to increase the cigarette sales in the city of Brockton. I think it's just going to allow this site to be used and to come back on board as a functioning site. So respectfully, we would request that this be allowed, especially where it was allowed at this site many years ago. And I understand that there's a regulation that says that if you lose your license, you don't get it back. But we're asking for the board to indulge on this request and allow this to happen, because it's going to bring a vacant and unsightly property back into the tax rolls and into some activity that Belmont Street, which is it's become one of the major streets in Brockton, and it's a gateway to the city, of course. So we really would respectfully request that the board allow this to happen, and I don't think it would add to any health issues in the city of Brockton, because somebody driving by, if they're not going to stop there, they're going to stop at the next place. So I don't think it's statistically going to increase the use of tobacco at all in the city of Brockton.
Right. Yeah, so the existing license was not part of the property, or the transfer of the property.
Yeah, there is no existing license. The license that was held by 7-Eleven basically was retired several years ago. I don't know the exact year that it was retired. We would ask, by the way, that if the board does see fit to allow this, that it be conditioned that it stay at this site and not move to another site.
Yeah, so this is a situation where we have to go, because to give a variance is to actually get rid of what's written as the mandate that's been in place for a time period, which other people have operated under since that ordinance was passed, of not allowing new licenses. We certainly allowed if a business changed hands at a site to continue to have that license, and there was a limit on the number of licenses within the city, because Brockton has more tobacco per capita, or for the number of individuals in the city, far more licenses, tobacco licenses, than in many other municipalities. So we're way on the high end of the curve. And from a public health perspective, it was passed by the board in an attempt to limit the number of licenses and the expansion of tobacco licenses within the city. So I think passing a variance is basically allowing that for the mandate is actually changing the ordinance. So I think it's important on our part. I hear, and this was added to the agenda now, but as going back and reviewing, there were some number of licenses, et cetera, that were allowed, but we'd have to go back and look at the existing. I think legal take a look at the existing things, and we may have to change the entire ordinance, because it's not to give a variance to one individual group where others have been turned down in the past could create some issues. So, and as far as the board is concerned, that was put in place with the idea that we were trying to decrease the number of tobacco licenses to bring it more in line with other municipalities, and to decrease the number of licenses within the city. So the board cannot, I believe at this point, without some review of the current ordinance and members of the board having time to look at that, and also the request in writing. So the actual request of what you're putting forward to the board, to receive those documentations and for the board to review it, I think need to be in place before we can make any decisions. Certainly cannot make one today. Mr. Fisk, do you have anything to add? Or?
Well, I just like to look into it. There was a tobacco license there at one time. During COVID, the last couple of years, I'd like to know if there are other stores that, weren't able to continue and went under. And if there are, if they fell apart and they're not in existence now, is those tobacco licenses, it might have been a few stores that went out that had tobacco license, and, there might be still, some out there that, it's not like adding more. It might be just there's some existing ones that maybe people, the convenience store is no longer in business, and so the tobacco license isn't there. I mean, this place had a tobacco license at one time, and the 7-Eleven, just didn't want to, go that way. but there might have been some other, during the last couple of years through the COVID that might have gone out. There might be, some tobacco license that, I'd like to look in and see if there are some, not where we wouldn't be adding anybody, new licenses, but there might be some old that, maybe we can do something with.
Yeah, so, I just have to look back at how the ordinance is written, because I don't think if a license is expired, I don't think it can be previous licenses can be reactivated. But again, it has to be, we really do have to go back and look at the current ordinance that's in place and the rules that we've been operating on and et cetera. So at this point, I think Attorney McCluskey, we can't make a decision here today. But from our end, we will we'll pull up the ordinance, review it. Please put the request in place, knowing when the 7-Eleven went out of business and if that, when the license expired. When the ordinance was passed, so we can take a look at things and go from there, and maybe bring this to the next board meeting.
Thank you, and I appreciate you again taking this on the agenda tonight, and I also appreciate the due diligence that the board will undertake in this and in making its decision. It's very appreciated.
All right, thank you.
All right.
I'm sorry for the wait at the beginning of the meeting. So, all right. Okay. So with that, why don't we move on to the next item on the agenda? I think these are more informational at this point. There's no action items, I think, to be taken except for our next board meeting. So Dr. Monsoor, you were going to bring us up to date on just some information on, I see that the city is still very high in COVID positivity, and also in our wastewater running on the higher level as well as continuing vaccine. So if you could just summarize some of the events around the COVID activity within the city.
Yes, thank you, Dr. Brophy, and thank you, Mr. Fisk. Within the last 24 hours, we have received 37, we have documented 34 COVID positive COVID cases, and those are the numbers that have been documented on MAVEN, which is the surveillance epidemiological program of the state. So right now we are at 506 deaths from the beginning of the pandemic to date. Active cases 247. And so it's a cumulative number of 31,594. The positive rate of COVID within the city as of Monday, it's 7.7% among the population. The wastewater gives us, it's over 1 million copies of COVID per 1 liter of water. So that brings us over 70% concentration higher than the other municipalities, and most of the other sewer being reported within the state. So that tells us that somehow there is a high level of concentration. The only thing we don't know with this is that there is a difficulty to really calculate the total number of individuals being positive, because so far the science behind the wastewater is not clear how you really relate the concentration with a total number of cases. And right. Different people share different level of COVID. So we don't know, but it's an indication for us that yes, COVID is still being spreading in the city. Also, I would like to say that for vaccine, we continue to vaccinate. It looks very good, and we remain in the double digit in the at the Shaw Center. Both the public health nurses, vaccinated there every Tuesday from 2 to 7 p.m. And then booster ambulance still vaccinated there also under the auspices of the Massachusetts Public Health. And we also continue to do vaccination at the Cape Verdean Association every other Thursday. Aside from those 3 sites, we continue to vaccinate with Council on Aging every now and then, the high rise and the low rises. We have a few clinics scheduled for between the end of this month and next month with different vendors, including the Haitian daycare, adult daycare. So we continue. What we don't see too much of our children 6 months old and older coming to get vaccinated, because somehow parents seem to be reluctant to have their children vaccinated. But we continue to vaccinate, and we are pushing. Also, I'm glad to also inform the board that we have been working with the law department and the mayor's office to have the language put in place in an MOU to allow Curative Inc. to do testing, which will be PCR testing within the city. So we have reached an agreement. On Tuesday, August 2nd, we had our last meeting. And right now we have a tentative date for the official opening of the testing site, which is August 23rd. Once opened, the testing site would operate 5 days a week, Tuesday through Saturday, Tuesday, Thursday, and Tuesday, Thursday, Saturday. That will be from 8:30 a.m. to 12:30, and then Wednesday and Thursday it would be 1 to 5 p.m. So right now this is where it is. We are waiting also on Curative Inc. To recruit staff to be able to fill the site. I mean the testing site. But once they do that, we'll be able to start running the site.
Great. Right. And all of this information will be on the website for folks if they are at all making arrangements or want to be vaccinated through the city's resources. So this will be on the website, obviously. And I saw the website. The information is there for individuals to find out about how to get vaccinated. So thank you. And you're continuing also to work with our various organizations within the city for media outlets regarding the information. Is that correct?
Yes, we are, and we are still working also with the faith-based and Massachusetts Community College and other health-related businesses. And most likely we will have the symposium that we mentioned earlier. I'm still thinking if we should have a health fair with it, because since the city was kind of in a lockdown with COVID, so we would like to participate and see to what extent we could have all the health-related businesses to participate and get some feedback, and then to see what we've done good, where we have failed, and then collect that information and move forward. I must also add, please, if I may, that with the epidemiologists that we have hired, we have prepared a health assessment for the city. It was just finished last week, and so we forwarded it to the mayor for his review as well. And I will make it available to the board. It's an oversight. I didn't get to send it to you a little bit earlier, but we have a first draft. And so we will be using it across the city to collect information on health and where we are and what needs to be done.
Great. No, wonderful. I think the symposium is a great idea to bring those involved in the city. It is a time to look back and say, what did we do right? What did we do wrong? What could we do better? But also the concept of, the impact coming out of the pandemic, because it certainly has had an impact on many other aspects of public health, homelessness, for a long period of time, the support systems for the homeless, for those with substance abuse disorders, for mental health related issues had not been handled appropriately. Even healthcare itself, we're seeing many patients coming into the hospital who have been seen for long periods of time with more advanced disease. So it's important, I think, to do this, and it would be nice to get perspectives from everyone in the city that's been involved in this, and how the city has done, and looking forward. So I encourage you to do that and to continue the good work that you and the department have been doing. So, any comments, Mr. Fisk? Or?
Well, I just had a question. Have you seen that the severity of the disease and everything in COVID has, people are still getting it, even though they're, vaccinated and so forth and boosted, but it seems like the severity of it, they're not as sick type of thing, which works out great. And the death doesn't seem, I haven't seen as much that way. So it seems like, we did the right thing and everything. And have you seen that the severity when people do get it now, that it's not quite as bad?
I think, the game changers have been that, when we first had, when the pandemic began, did not have any, what we've learned. Clearly, the vaccinations has made a huge impact in patients that previously would have had severe disease, of blunting that effect. Most of the patients that we see in the hospital now that go to the ICU and are severe are patients that are not vaccinated. Those that are vaccinated often have comorbidities or other reasons. They have lung disease, and pick up a mild case of COVID, and supportive care and the medications that we give right now, clearly in some and are available, widely available, can clearly decrease the severity of the disease. And there's clear protocols for use of all of those medications and availability to get it. Also, if people are having issues with getting, there's a lot of home testing going on. If people turn positive, it's contacting your physician to get the Paxlovid, which is the oral treatment, if they qualify for it, is available. But also there's a state website where they can do a telehealth appointment and supply people who may not have an established health care provider to give them a prescription. So I think, and I don't know, Dr. Montesor, if that's on our website, but I think it's an important piece of information that if you test positive, there are medications that can help you to continue to have mild disease that can be handled outside of the hospital. If you need to come in, there are medications that we can give in the hospital that will clearly keep severity of disease under control, and that people should be aware that they, in seeking, if they turn positive, to check the state website, or a link on our website to the state website on the availability of treatments and how to be able to access that. So
yeah, thank you, Dr.
I don't know if that exists.
That's very good information there.
Yeah, we do. Thank you. No, that's a great point, and thank you, Dr. Brophy, for highlighting that. With respect to Paxlovid, which is the medicine that FDA has approved, we do push it. In fact, we have one epidemiologist that works together with the case investigators and people who have had COVID in the past and who maybe get infected again or new cases. We encourage them to call their primary care and get the medicine, or call the pharmacies, because the pharmacies can prescribe it once they have the medical history of the individual, because they have to look at the medical story and rule out any side effect for existing conditions. But we don't have a great demand for it, but we will continue to push it so that people know that it is available. Yeah, and they can. They don't. Yeah, they can. It can be, once it is prescribed, it can be delivered at their doorsteps without they going out. To receive.
And it does require a review of your existing medical health and also your medications, because there are drug interactions. so the pharmacy, if patients or individuals are requesting it, knowing what medications that you're on is important when you're being evaluated, because there are some drug interactions that need to be taken into account in prescribing it. So, okay. I guess we've covered most of the items on the agenda. I guess the only thing is a miscellaneous item that was added is that Governor Baker signed an order to extend the remote meeting for public meetings until March of 2023. Is that correct?
Yes, that is correct. The law department has informed us, because they watch very closely those those protocols, so that can update the city, and then so that we can be up to par with the law.
Yeah, great. And I would just add one other question. I know the issue. I don't know if the board has been approached by this, but calls about monkeypox and availability of vaccine within the any cases within the city, or people that have been calling about vaccinations. I didn't see anything on the website, but it looks like the state has set up a number of places where you can be vaccinated. Many of them are in the city of Boston. I think the closest to the city of Brockton is in Randolph. But again, something that even a link on the city webpage might concerning it. And the availability of the vaccine for those that are concerned to be able to have that information.
I'll do a follow-up. I'll do a checkup, but I did send a note to IT to post. So I'll revisit that to make sure that it is there.
I may have missed it in going through the thing, but there wasn't like something that I immediately saw on the thing, and I was just wondering if you are getting calls about vaccinations and
yes, in fact, we receive at least, to my knowledge, there were 2 calls that were made to the department to find out if we have any cases in the city. The news to date is that there were 4 suspected exposure cases, but after the specimen were taken from these individuals and sent to the lab, to the state lab, and the result came out negative. So therefore, right now, as it stands, we have no known case in the city.
Right.
Yes, there are 2 vaccines being available for it, as you know. One is Genos, which is one of the 2, and then the other one is ACAM 2000. ACAM 2000. So the request exceeds the demand because federal government is the only one that is designating special sites in the states where they can make them available, because given the population that is mostly impacted, so they are very selective. CDC is very selective as to where they make it available right now. So in Massachusetts, as of the 29th, we've had 113 cases of COVID. Strike that. 113 cases of monkeypox. Nationwide, there have been over 5,000, but the vaccines have been very slow coming, but we working with this to see how we can also be considered if should we have any case here or people could get vaccinated. But right now, they do not. Federal government does not look at it as a health emergency. No.
No, and I recognize that. I just want to know that people in the city are aware that the information is available to them about if they have any questions, that they may come to our website to look, and just to be sure that they're pointed in the appropriate direction, because the state does have clear guidelines and also a list of all the sites where the vaccines are. So just to be sure that if anyone is looking our way, to use our website as much as possible to keep the keep the citizens of the city informed. So, great. So I think that's last item on the agenda. So only a remaining item is to set the schedule for our next meeting, which would be September 1st. Noted that next meeting of the Board of Health will be September 1st of 2022. And in the meantime, that there may be a special meeting regarding the recombinant DNA guidelines and applications for the city to become eligible to have manufacturing and other DNA research facilities within the city. And that will be posted publicly as well, because it will be a public meeting once it is set. So with that, motion to adjourn the meeting.
Motion to adjourn.
Second, and thanks everyone, and thank you, Dr. Monsour, and a very informative meeting, and thanks for participation and to thank the members of the Board of Health that have been doing a fantastic job in the city during this entire pandemic, and recognition of your now broad approach to public health within the city, which is very needed, and as much assistance as you need with that symposium, the board is happy to support you. Okay.
Yep. Great job.
Thank you. Thank you
Okay,
very
thank
much. Thank you.
Take care.
All right.
Take care.
All right.
Bye now.
Take care. Bye bye.
Bye-bye.